Understanding a heart attack. Evaluating risk of a heart attack is of the biggest significance, simply because heart disease is not always detected. Even though numerous factors with this ailment can be controlled, there are many you are able to reduce or eradicate. A heart attack can happen if a blood clot entirely prevents oxygen and nutrients-rich blood stream from flowing to the heart, or if not sufficient oxygen-rich blood can pass through this blockage. Heart attack is a layperson's expression for the sudden blockage of a coronary artery. It is triggered by the damage of the area in the heart muscle. It is also the leading cause of death in the USA, and sudden death from heart attack is by far the most common consequence of cardiovascular diseases, which obviously means that it is a medical emergency. Alternative treatments focus on preventing the advancement of heart problems that results in a heart attack or stroke. Few can remember now that heart failure used to be a death sentence and completely incurable condition. Among the less known signs of a heart attack is indigestion, or condition commonly known as heartburn. Now, different therapies concentrate on stopping the progress of cardiovascular illnesses that result in a heart attack or stroke. Heartburn is just one sign, but most of the signs can differ considerably from person to person. Symptoms could also disappear and can come back again. Understanding and discovering heart attack indicators assists in speedy treatment. We believe these signs and symptoms are absolutely nothing and may go away, but the truth is these symptoms tend to suggest that something is not right with our body. Symptoms typically show up several hours to a few days following a heart attack, even though sometimes they might be delayed a few weeks and even many months. Warning signs of heart-related illnesses frequently go undiscovered, simply because we, as a modern society, generally will have a tendency to tolerate what we might call heartburn or dizziness or swollen legs and a lot more without considering it essential to visit a doctor. The signs of heart problems happen when plaque accumulation within the coronary blood vessels lead to a decrease in blood circulation towards the heart. Once you have experienced a heart attack, the risk that you might have yet another one is greater, and you could feel uneasy and be worried about being cautious in anything you do. Therapies and medications are offered in order to avoid clots, decrease the heart's workload, and minimize cholesterol levels. In the time following a heart attack, necrosis can spread, causing a significant portion of the heart muscle struggling to carry out the job of pumping enough blood as it used to. But there are some independent researchers who spent a lot of time looking for solutions to prevent this and also to recover after a heart attack happens. In some cases, it may also be possible to contain the damage and improve a heart's condition. Now, it is my opinion that independent researchers and their results should be made available to everybody, and that's in part what helps this world grow. But also, results of such researchers and methods they used and any usage of such methods is the sole responsibility of the persons who decide to use it. Disclaimer: no information here should be considered medical advice. Information provided here should not be used to replace the advice from your physician or other healthcare professional. It is here for entertainment purposes only.